to you very quickly. Short lecture. This actually should have been done last week, and quite frankly, there's a lot going on around here, and I didn't get a chance to do it. So there you go. I'm only human. Some people argue that point, but nonetheless, here I am. Yay me! And I want to talk to you very briefly because this is something that at this point in your training, you are very, very intimately aware of, and that's ethics and the management of ethics in counseling. So I'm not going to belabor this point. I'm just going to hit a couple of highlights here, and the next lecture will cover chapter 21, and then that'll be it. That lecture will come to you next week. I don't know. I had to look on the syllabus and see. At any rate, the next quiz is for chapter 20 and 21. So I apologize for being behind, but as I say, things have been going on, and sometimes some of these things, the lesser important, I hesitate to say that, don't actually get done. This is pertinent. It's kind of my way of leading you through this stuff. But as you know by now in the semester, it's not something that you're going to be taxed with. It's just my way of touching base with you more than it is anything else. And I'll touch base with some of you guys anyway when we have our weekly meeting in the internship class. So away we go. Same thing. Brief overview. What this chapter is talking about is managing your behaviors in sex therapy. Since this class is human sexuality, of course, that's what we're concerned with here. There are cases. There's case law related to this. You have obligations. Sometimes your belief systems and your obligations don't mesh, and that's happening every day. It's happened in the past. It's going to happen in the future. But in certain circumstances, you have parties involved who decide, hey, I'm going to court with this. So you got to be on your P's and Q's in this ethics business. When I was doing my master's degree, and more particularly my PhD, I think I had like 4 ethics courses, and that was it. Four courses covered nothing but ethics and what you can and can't do and how you should go about it. So that's kind of what this chapter overviews. For example, there was a case. I don't remember the university. There's a case that's pointed out in your book at Eastern Michigan where a counselor, it could have been an intern, did not feel comfortable with counseling homosexuals because it violated that counselor's or intern, I don't remember which they were, it violated their religious beliefs, and they said, no, I just can't do it. Well, they were offered opportunities to correct that, if you want to call it correction, and they kindly said no, and they were dismissed. So some other organizations became involved, the American Counseling Association for one, and talked about the ethics. And what it boiled down to was the counselor could not refuse against or refuse to treat a homosexual client based on their own personal beliefs. And the only way that they could legally and ethically decline treatment was to refer a client to someone with the understanding that you are referring them based on your lack of ability, based on your feeling that you're not up to the training or haven't had the training that they need or that you need to counsel them, my bad. So you can't do it. You can't refuse treatment because you don't believe in it. That's what this thing is saying. I don't believe that I want to treat you because you're Islamic. Can't do it because you don't believe in Islam. Well, okay, I get it, but according to the ethics standards, no. And this could have changed lately. This thing is ongoing. It's constantly ongoing. There's another thing that pops up quite frequently. Doesn't even have to be in sex therapy casework. You mean any counseling situation, and we were very, very sternly warned about this. And I'm sure you're aware of this by now. When you are a counselor or a psychotherapist, this may be the first time that a client has had the opportunity to really clear themselves to someone who is not a threat. And now you're listening and you're being compassionate and empathetic. And sometimes that backfires. You have to really watch the boundaries. You have to practice risk management, because if not, you're going to potentially, even not meaning to, cross boundaries. And in the case of our course here, sexual stuff, crossing a sexual boundary is a major big no-no. There are even some guidelines related to that you shouldn't have any contact after therapy with a client for about 2 years. I guess that's some magic figure. I don't know, but you shouldn't cross those boundaries. So this cautions you about these boundaries. You can't use what you do as a kind of a bribe for stuff you know you shouldn't be doing. So that's another major sore point, and it's discussed in this chapter. Males and females, as far as your position is concerned, sometimes face quite different situations. Male dominance in a therapy session, for example, a perception of that, or a female's weakness. Any number of these aggravating circumstances could cause you to get into an area that you're going to have a hard time getting out of. And if you slam the brakes on right away, then you're probably going to be in a much better situation. I'm glancing at my notes. That's why I keep looking away from you, as usual. One of the things that I thought is interesting, and this was, believe it or not, wasn't that heavily discussed in my ethics classes, was physical touch. Some people like to use that as a calming thing, or showing empathy, or whatever the case is. Reach across and pat them on the hand or whatever. Any kind of emotion, any kind of indication can be taken the wrong way. And now again, we're dealing with sex therapy here, rather. Human sexuality, sex therapy. So, hey, you really got to be careful about your physical actions. You got to be very careful about what you say. How do you say it? Is it insinuating? Or is it saying, well, you know, maybe we could do better if we got along a little better? Yeah, okay. Not good. So you need to keep these things in mind in terms of legal problems that you may run into. I think the American Psychological Association is where this 2-year thing that I mentioned a while ago comes from. And then finally, to wrap this up, I want to talk to you very, very briefly about this referral business, and going back to the situation where this person said that they didn't feel like that they were capable of doing the counseling because of their religious beliefs. Really, the only time that you can legally refer treatment in those situations, and this again, this reiterates, is when you explain to the client that your training you don't feel like is at a level that would be helpful for them. You want to refer them to somebody who has more knowledge and better training in the area that they're having difficulty with. It's not a cop-out. There's a discussion about bias, where you have to be aware of your own biases. I've mentioned this before. The French call it épouche. Maybe you can fact check me on that. It's been many, many years since I was involved in that. But remove myself from the situation. In other words, slam the brakes on my biases and let's deal with the problem at hand. Your biases cannot be a part of your counseling at any time, never ever. Now, the fact of secrecy in a therapy setting, I'm thinking that you guys, I'm looking at the notes, but I'm thinking that you probably already have been led in that. You have to maintain the same standards of confidentiality as a medical doctor. So the discussions that you have outside of the session are limited. And I think you probably already know that. So if I'm going to my supervisor and I say, look, we've got a problem here and I'm not too sure how to manage this part of it, then most likely you're going to be able to loosen up a bit, but within reason. When it's a matter of treatment, then there's a little bit of a difference in how you manage that sort of thing. And your supervisor will lead you in that. I'm not going to lead you in it, and I'm not going to talk to you about it simply because sometimes that's a practice thing. Obviously, the federal laws are the governing thing, but you also need to know what your supervisors have to say about that in your particular practice. So, with all that being said, I will be seeing you again, and I'll jump over to the next, and it's the last chapter, and get you all set up for this last quiz. All right, so where we go. I got to find my little mouse. There it is. And I got to find the right button. There it is. And I see you.